And good morning, everybody. My name is Bai. I'm the founder and CEO of AYZH. And I want to begin by thanking everybody who's on this call, which I don't know who is, and also all the GSBI staff, mentors, our advisors. With special thanks to Sundar and Kapil, who've been a great resource for us through GSBI throughout this process. Coming back into the presentation, my name is Zubaida Bai. I'm the founder and CEO of AYZH. And we pride ourselves in being in the business of saving lives. AYZH was started as a shared vision between three individuals, myself, Habib Anwar, and Kellen McMartin, a few years ago to bring appropriate technologies to market for the benefit of poor women who've been abandoned worldwide. Over the course of our market research and figuring out what we're going to do with AYZH, there was one big problem that emerged, which was very clear near and dear topic to my heart, and also resonated with one of the personal experiences I've had. And so I steered the company in moving in the direction of maternal health in the topic of safe and clean delivery. Next slide, please. To give you a little bit of a context of where we started, I think, to set a context, I want people to understand that we are not going to be talking about necessarily home births, but we're going to be talking about institutional births and the problem of births happening in both institutions and homes. And I think I want to start with also an assumption that many of you on this call actually know of one woman, at least in your life, who's given birth and who's been a mother. And I pride myself that this assumption is always 100% right, and I'm assuming that it is the same even here. According to recent census, we know that in India, about every 2 seconds, a baby is born. Next slide, please. And unfortunately, you know, by the time I finish this call, about 150 babies are going to be born. And not many of them, in fact, more than 50% of them are not going to have a clean to be born on. Now, this is one of the biggest health issues that's haunting women who do not have access to a clean birthplace to deliver their baby, which is the biggest blessing of their life. Now, as humans, again, as I cautioned you, we think that this is only the situation in homes. But if you look at the picture, you will kind of come to consensus that it is also a huge dire situation in institutions in India and many other parts of the world. Right? If your child is born in rural India, we can safely assume that the child is going to be delivered with a clean razor blade that men use for shaving, or with a sickle that is used to cut grass during farming, right? And if a mother is lucky enough to go to a healthcare institution, you know that despite the government trying hard to make the situation better, you will find that dust, flies, and bloodstains are a constant nuisance that you will find in many, many institutions in India will deter a clean birthing environment. And just because of lack of access to clean and sterile birthing environments and tools, we lose about 15% of the mothers and babies that are kind of deprived of a healthy and nice life, right? And they cannot bring their kids into the world for all lack of basic common sense that we are not able to implement as human beings. Now, with looking at this big, enormous situation of lack of access to clean and sterile deliveries, let's move to the next slide. AYZH came in as a promise, and our promise was to provide low-cost, high-quality products that are made by women for women, to bring appropriate technology to market through innovative thinking, and to make sure that we customize these products for a variety of end consumers that are out there. And most often, and most of it, we want to provide access to life-saving products to these women. And with that in mind, and keeping our promise, next slide, we launched our first product, which is a clean birth kit, which costs $2, that not only comes in a beautiful biodegradable bag that you see, that is given to the mother as a gift post-birth, but also contains in it the 6 simple tools recommended by the World Health Organization that provide the clean and sterile and safe delivery, preventing more than 15% of the deaths that happen at the time of childbirth. Next slide, please. So the 6 cleans, as we talk about, or the 6 tools that we provide, are for clean hands, for a clean perineum, for nothing unclean being introduced into the vagina, a clean delivery surface, a clean cutting instrument, and clean cord care. And those are the 6 cleans that we provide for $2. We also have over the years started customizing our kit, and the product costs between $2 and $5, just based on the components that are required in the kit. We're also, I think by now you must be thinking, like, can we sell such a product? And we pride ourselves that over the last 3 years, we've sold over 50,000 kits in the market, impacting lives of 100,000 people, which is including the mother and the baby. We're not even considering of all the other social impact that is caused by the intervention of this product. And just last year alone, we sold about 35,000 products. Next slide, please. Now, thinking about competition, which is a very important thing that comes to mind when we talk about such products, yes, we do have competition. And we've probably listed a few kits in the slide here that basically range from anywhere between 50 cents to $2. Again, the same price point. But I think the biggest advantage that we provide over them is if you want to buy one of these kits, I'm sure you'll spend a lifetime figuring out how you're going to buy one, because usually they're donor funded. They come in when money comes in, and people put together stuff and sell them as kits. And they also contain what we call very crude equipment, like plastic sheets, razor blades, and threads. Whereas what ICE provides as an advantage is a constant supply of kits in the market, the customizability of the kits, and also the high-end medical products that are required and are sterile. Now, one of the kits that we think is also customizable in this chart is the birthing kit from Australia, but it sounds insane to us as somebody putting donated items in the form of a kit in Australia and kind of distributing them to countries like India and Africa. And again, only based on donations and only based on corporate women having time to come and assemble these kits. Next slide, please. So moving on from the clean birth kit, I think we've kind of seen that there is a huge need in the market, at least in the market that we are serving, and we've kind of constantly been asked by our customers to provide new products. And hence, based on the inputs that we received from our customers, we're planning to launch a newborn kit this year, which we have piloted, and we are kind of partnering with Frog Design to bring a conceptual model they had in mind, and an on-the-ground model that we received from customers, and kind of bringing together a globally relevant, healthy newborn kit, which we hope to launch this year. We also have started researching on another big problem in maternal health space called postpartum hemorrhage, which is death of a mother within 10 minutes of birth if we do not detect that she's bleeding profusely, and kind of indicator of her bleeding. And then we're also working on, we also hope that we'll be working on a sanitation and hygiene solution for women post that, which will pretty much be in 2016. Next slide, please. One big important component of our work is not a very high impact, but the 20 women that we've hired at the back end, who we've kept employed over the last 3 years, who are making at least 300% more than what they would make otherwise. And these are the women that are very proud of working with us and kind of serving other women that they work. So though this is not our core impact, we think that this is a core group of women that keep us going. Next slide, please. Just to give you a little bit of background on the progress we've made over the years. As founders, we invested about $20,000 of personal fund in 2010-11. In 2011, we won in kind and through grants and competitions very close to $100,000. In 2012, we raised a first round of seed investment, which was, I think the number is not right there. It's about 280,000 US in combination of debt and convertible debt. As of December 2013, again, the number is wrong. We've sold about 55,000 kits out in the market. And we are very proud that the products have not only been sold in India, but many countries in Africa and Latin America. Currently, we are planning our scale. We are planning our scale in India through a franchisee model, for which we are supported by various entities like MIT B Lab and Karuna Trust in India. And in Africa, our scale pilot is happening in partnership with Kiva, where we've identified about 15 entrepreneurs on the ground who raised over $15,000 on Kiva's platform to become our entrepreneurs in a record-breaking 0.23 days average. And so I think our scaling pilots have been going really well, and hope we can grow and impact more women. We also have launched a mobile training program to go with our product, which means every healthcare worker who will have access to our product can also sign up for a free mobile voice message training around the 6 cleans, breastfeeding, and family planning, which we have launched in partnership with Rural Technology Business Incubator at IIT Madras, a very proprietary training program to eyes. And finally, I think we're in a very good position to launch our newborn kit this year. We are right now wrapping up our study, market research study, and in parallel starting to build the kit. And we are pretty confident that we will launch at least 1,000 newborn kits to test market no later than June this year. Next slide, please. So moving forward, just to give you a little bit of a sense on how we work, we are a B2B company, business to business. We buy products from suppliers. We assemble them at our nonprofit assembly center. And then we have a sales team right now who sells either to distributors, which is a very small percentage, but directly to medical institutions and nonprofit institutions. Based on where they're sold. If they're sold at a medical institution, the customer buys, the end consumer buys it from a pharmacy at the medical institution, or if it's a nonprofit, then they make available the kits to the customer through their clinics or charity hospitals that they run. Next slide, please. We also think that we have a huge market size of about 30 million women between India and Africa, and our market is segmented pretty much into public-private partnership and organizations that are directly in control under the government. Plus also we have a huge global market where we've had a lot of random institutions placing orders with us by email and phone. Next slide, please. We also know that we mentioned some direct competition in a couple of slides before, but we also have a lot of indirect competition where we have people who can just sell the component individually, or we potentially have a lot of groups who might enter the market as copycats and just make our product. But I think where we stand different is the strategy with which we've created the market and sold products sustainably over years. And so I think that our distribution and marketing strategies are what set us apart, and not necessarily the product. But also I think the theme of the product, which conveys the importance around the product, is very important. The ecosystem that we create around the product with training and advocacy, I think that's very important, and that's how we differentiate ourselves. Next slide, please. I think I spoke to a little bit on the anticipated risks and our mitigation strategies in the last slide, but I think we work a lot on consumer acceptance. We make sure that we give our end consumer what they want. We partner with nonprofits and various corporates to give them information about breast cancer, ovarian cancer. We give them kind of options to choose, even in a medical product. Like we have different colors of packaging, and women can choose from that. So we definitely work on consumer acceptance. We are always striving to create a market niche with our products, and I think again the packaging plays a whole different role in the medical space there. I think for us, building a brand equity is also very important. That will help us mitigate the risks such as the competition and supplier power. And I think slowly and steadily we know that we have a specific team within us working on brand equity all the time, and it's definitely helping us mitigate a lot of risks there. Next slide, please. As a company, we know that we are struggling in a very narrow space where we have not found any company working in the public health space as a for-profit, as a solely for-profit company. And hence, we also have to make sure that we have good profit margins. And we've been able to steadily maintain a 40 to 50% gross profit margin over years with our product. I don't think that this gross profit would grow up despite our volumes growing up. I think it will be pretty standard just because we are a just-in-time company right now, but as we grow, I think we'll have more inventory costs and more storage costs. But we are pretty certain that we'll be able to maintain a 40% average margin across our product range. Next slide. I think as I move into the team, I really wanted to acknowledge how important these women are and how committed they have been with us over the last 3 years. But we also have a management team, and I will start, next slide please. With myself, I'm Zubaida Bai. I'm a mechanical engineer. I specialize in product development and design, and I hold an MBA in social and sustainable enterprises and have been in the social enterprise space working in product development, design, and commercialization for the last 10 years. I have Habib Anwar, who is also who's an international business MBA, also an MBA in social and sustainable enterprises. He brings over 15 years of experience from the corporate sector in operations and strategy and finance. And he leads our operations and finance at ICE, obviously. We have Colleen Lyon, who again is a master's in sustainable enterprise. She has an MBA, and she helps us with our communications and partnerships with funders and business development. We have Ashley, who brings over 7 years of pharma consulting experience and heads our business development and sales on the Indian side. We have Rehana Razak, who is a media graduate and who's been heading our operations and sales and partnership building again in India. We have Leslie, who brings decades of experience in communication, and right now is helping us with our branding and media strategy. We have Sanjukta Das, who is helping us with product design and consumer input. We have Anika Gupta, who is temporary on staff with us, but helping us build our scaling strategy in Africa. We have Baneen Karachiwala, who is a monitoring and evaluation consultant who has been working with us for a while, helping us measure the impact of our product in institutional settings, and we will have our results out soon. And then we have Mohan, who is our field coordinator and helps inventory and logistics on the Indian side. Next slide, please. We also have great advisors, again, starting with Kapil and Sundar, who've been our GSBI mentors, who have helped us in a long way in kind of developing strategy and kind of firming up numbers. We have Amy Smith, who's the founder of the Design Lab at MIT and helps us with product development and design. We have Mr. Mukundan, who has been in the social enterprise sector for over 30 years now and specializes in rural supply chains and marketing products in rural India. We have Jonathan Spector, who is our clinical advisor, and he helps us do monitoring and evaluation and kind of be abreast of the public health space and kind of bring that knowledge into the business side. We have Kellen McMartin, who is our co-founder, but right now advises us on corporate communications and strategy. And to top it all, we have Emily Aiken, who is a branding strategist and who is totally involved and is the culprit of bringing the pink to ICE. We were a totally brown and black company, but I think she's given and elevated our brand a lot over the last 2 years, and we can't thank her enough for that. Next slide, please. We have been lucky and fortunate to be supported by a lot of partners, awards, and fellowships. Echoing Green, Ashoka Changemakers, TED, the World Economic Forum, D-Lab at MIT. I think we've had a lot of these people kind of recognizing our work, which gives us a lot of credibility in the space. Next slide, please. Moving on, I think we come to the most important vitamin needed in business, which we call vitamin M, or money. Our cash flows, we are looking at raising pretty close to 3.4 million in the next 2 years, out of which we are fortunate that we have a soft commitment of $1 million this year, and hope to match it with another $1 million this year. And over the next year, we are hoping to raise a lot of grant money for new product development and radical product development in the space. Next slide, please. We are also, again, very fortunate that we have a selling product. In 2013, we had a revenue of 97,000 US. 2014 onwards, we hope to do our big round of Series A funding and kind of moving forward. Once we raise the money, I think we will definitely break even somewhere close to end of 2017, and thereon we feel we will scale much rapidly towards that. Next slide, please. I think pretty much close to the end of my presentation. I just wanted to kind of summarize what we've been doing for years now. We want everybody on this call to remember that we are a company providing high quality, low cost, beautiful products in the women's health space. We have a huge international expansion capability. We have a proven model over the last 24 months. And in the next 12 months, it will dictate our future by the amount of money we raise. We have a huge social return on investment. We have a non-obsolete market, which means women are definitely not going to stop giving birth, not at least in the developing world. And so we are operating in a very positive market space. We know that maternal health has been a very big topic in the global agenda, especially with 2015 fast approaching, and none of the countries have met their Millennium Development Goals 4 and 5. We also want to let people know that right now we are seeking 1.2 million as convertible debt for program-related investment, with which we hope to impact over 5 million lives in the next 5 years, and that we already have a 1 million in soft commitment, for which we are trying to raise the 1.2 million as match. I think that brings me to the end of this presentation, and all I want you guys to take away is that we sell a $2 product, we save lives, and we are very well poised to scale with a little bit of impact investment bumped into the company. Thank you very much.